An update now from the Capitol on a bill filed after our team's reporting on the state's antiquated death investigation system. Today, most of the 254 counties in Texas utilize elected justices of the peace who have scant training and often lack medical expertise to conduct inquests when someone dies under questionable circumstances. We highlighted the issue in our investigative report, A Hanging on Backbone Creek. Now, Senate Bill 1370 aims to create more opportunities for counties to use medical examiners, doctors trained specifically in conducting autopsies. And this week, the Senate Committee on Criminal Justice passed the measure onto the full Senate, one step closer to becoming law. Testimony was short, with no one speaking against SB 1370 during the committee hearing. Speaking in support was a forensic pathologist who serves in one of the 14 Texas counties with a medical examiner.
The best service that you're going to get for your citizens and for the families of the decedents is to have a physician investigate the death, and the compassion of every society is measured by how they treat their dead. So we need to be respectful of the decedents, and we need to be able to properly certify their deaths.
The legislation would lower the population threshold legally requiring counties to establish a medical examiner office from 2.5 million to just 1 million, meaning the state's growth could force more counties to take that action sooner. There have been cost concerns with such a requirement, so the bill also allows neighboring counties to establish a medical examiner district, sharing costs and resources and a medical examiner, a unique opportunity that only exists today in a 4-county region in North Texas.
Ensuring more counties are equipped to handle critical death investigations in a timely, consistent manner. The bill also clarifies that any 2 or more counties, regardless of size, can form a medical examiner's district. This allows counties to share costs, personnel, and expertise, which is especially important for meeting increasing forensic needs without duplicating services.
The bill received unanimous approval from committee members present in the hearing, and perhaps one reason it had such solid support is because 3 of the 7 members on the committee have strong ties to the topic, each living within that existing medical examiner district in North Texas, including Senator Brent Hagenbu, who you just heard lay out the bill, and Senator Tan Parker, one of the bill's 2 authors. Just 6 months since we first questioned Senator Parker on this topic, and a month since he filed this bill following our investigation, it now goes to the full Senate for a vote, a major move forward in the legislative process. There's also movement on the House side of the Capitol, where an identical companion bill was filed this month and now awaits its own committee assignment. Texas is one step closer to tightening rules on who can give Botox injections and other similar treatments. The Texas Senate passed legislation to prevent barbers, cosmetologists, and estheticians from administering Botox and other injectables unless they are licensed or authorized to give the shots. Senate Bill 378 would also give the Texas Department of Licensing and Regulation more disciplinary authority if something goes wrong. Our backroom Botox investigation first revealed anyone can become a certified injector under the supervision of a medical professional, but there's also a lack of oversight, especially for operations out of the back rooms of salons and boutiques. The bill's author, Senator Charles Swertner, told lawmakers there have been increased reports of Botox parties, which include unauthorized injections to friends and family without proper supervision. The bill's next step is a House committee hearing. We'll keep tracking its progress. You can find full coverage on our website. Just click the link in this week's State of Texas story. A bill to require crash-rated safety bollards at hospital entrances, sparked by our series of investigations, advanced unanimously out of the Senate Health and Human Services Committee. It now goes to the full Senate for a vote, possibly early next week, according to the bill's author.
Thank you, Senator West. We're going to let that go to the floor, I think.
Oh, to the floor. Okay.
Yeah. I think we'll let that go to the floor. But thank you and congratulations.
The committee updated the bill to exempt rural hospitals and those with existing bollards or crash prevention systems. It comes about a week after we were invited to testify at the Capitol. Investigator Matt Grant, who you see there, spoke about last year's deadly crash at St. David's North Austin Medical Center and the frequency of similar crashes our team found around the country. The bill is fiercely opposed by the Texas Hospital Association, which called the safety step a one-size-fits-all mandate on a single industry. SB 660 author Senator Royce West said in a statement, "This bill will save the lives of Texans and add to the safety of Texas hospitals. And we have addressed the concerns of hospitals who already have crash systems to help this bill move forward." The Texas House is moving closer to advancing one of Governor Abbott's top priorities, education savings accounts. On Tuesday, Abbott brought Lieutenant Governor Dan Patrick and House Speaker Dustin Burrows together for a news conference. The Senate already passed its version of the ESA bill. Burrows said the House will soon follow suit.
We can fully fund public education and provide meaningful opportunities in competition through school choice at the same time, which is why the House has been committed to passing both SB 2 and HB 3 in tandem.
Burrows said the House Public Education Committee will pass both an ESA bill and a bill funding public schools in the coming week. But even as legislation advances, there are early signs that this session could go into overtime. Lieutenant Governor Dan Patrick told the Texas Tribune this all depends on two bills. One is Patrick's priority bill to ban products that contain THC. Right now, it's legal to sell hemp-derived THC in Texas. State senators passed a bill that would ban those products, but it's not clear if there's similar support in the Texas House. Legislation pending in the lower chamber calls for more oversight rather than a full ban of THC products. The other bill Patrick wants lawmakers to pass is bail reform. The proposal allows judges to hold those accused of violent felonies without a bail option. Critics of the bill say increasing pretrial detention would strain crowded and understaffed jails. The bill addresses one of the emergency items Governor Greg Abbott listed in his State of the State address. That's significant because the governor is the only one who can order a special session. But Patrick does have influence in his role overseeing the Senate. If he blocks legislation the governor considers priorities, it could lead to a special session call. Texas prisons without air conditioning. Now a judge sides with prisoners who say those conditions are unconstitutional. But find out why he's not ordering the state to immediately fix the problem.